Okay, let's talk about physical therapy. So, this, first of all, is not a medical professional diagnosis or remedy for anything that you may have. Please feel free to consult with a physical therapist or a doctor. However, let's continue. If you've got problems and pain in your joints or legs, arms, back, elbows, anywhere that there's a tendon attached, this type of therapy can help you. The diagrams you see are general for acupressure and acupuncture, showing your feet, for example, and all the different ways that it actually connects your body. Let's talk tools. So here we are with tools. We're going to start out with something simple that most people have around home, right? Instead of always having to buy a bunch of specialty tools, let's talk about a butter knife. The reason I'm showing a butter knife is because most people have it. It's not sharp. It's got a soft edge that usually does not have very much serration. And it's got another flatter edge on the back. If you wanted to use this as a tool instead of buying anything just to see if this therapy even works for you, feel free to do so. You can even use the handle of the butter knife. In other words, when you hold on to the actual blade, it wouldn't cut your hand. So that's one option. If you wanted to go ahead and purchase any of these other items, I can give a link on where they are located. Typically, I get them off of eBay. And this is one of my newer tools. It's a metal one, obviously. It's a gua sha tool. And gua sha is one of the techniques similar to what I'm going to show you. This tool is good because you can hold it with your fingers. In the loops, it's got a little round head here, which helps with pressure points, again, for acupressure. And you can even flip it over and dig in some of the joints with the back. One of my other favorite tools is this one here. And this one is actually made of a plastic carbonite. There's another one that I have that you'll see in the video of the same tool made in wood. And I do love that tool. However, I misplaced it somewhere for the video. Probably when I went on my last trip, it's in my bag. But this one is made so that you can hold it again on the sides. The curved edge will go along some of the curved parts of your body. The rounder edge, convex edge would be the one that goes deeper into some of the tissue. And then at the top, you have the section with the little ridges that can go between joints or knuckles. Lastly is this large wooden tool, and I use this mostly for doing like my thighs or the back of my thighs. The handle helps me hold it because I have had surgery on my elbows, so holding things can sometimes be a little difficult after you've been doing it for a while. So one of the things I like about this is the fact that I can grip it in that way. I can also turn the tool over and use the back side of it as well, and those corner edges allow me to dig in deeply to different parts of the tendons. Now, again, what we have is a stem, which is done with plastic tools, gua sha, which is done with various types of tools, but it breaks the capillaries, and we don't want to break the capillaries in this. We're going to do a variation of a stem. Grafton is another term people have heard in therapy, and it's done with metal tools. So the only real difference between Grafton and A-stem are metal versus plastic tools. And again, gua sha is an Asian version, which has been around before all of them, but it goes a little bit harder than the way I scrape, and it's there to break the capillaries. In our case, we're going to do light maneuvers, medium pressure, but nothing where you should be severely bruised or showing blood capillaries broken underneath. All right, let's take a look at our first demonstration here. So this is obviously an arm, and I'm using this technique on fair colored people for specific reasons because I want you to see the color variations that change. And the color is going to be there whether you have darker skin or fairer, lighter skin. But I figured it would be a lot easier just to show you here so you'd be able to have visual as well as some of the techniques to use. Again, this is where I'm using that wooden tool that I really do love that somehow I've misplaced, so I can't show it to you up close, but you'll see it here in the video as I'm talking about it. Now, when you start to do these therapies, you're going to find a joint, in this case, the elbow to the wrist. And you're going to pick a direction, whether it's going from the elbow to the wrist or it's going from the wrist to the elbow, it doesn't matter. But when you're doing the therapy on that specific day, always go in one direction and one direction only in that jointed area. Similar to combing your hair. You're going to go ahead and put some kind of a lubricant, whether it's a lotion or an oil, on your skin just to help with the sliding of the tool. And then you'll go ahead and get a hold of your tool and start to give medium pressure in one direction. Again, in this demonstration on the arm, we're going to go from the elbow down to the wrist. Don't go past that joint into the next joint. And if you wanted to go from the elbow up into your arm and from the elbow down to your wrist on the same day, that's fine, because that's two separate joints with two different sets of tendons. Again, think of it as combing your hair out. If you went back and forth in the same direction, you would be tangling your hair. Tendons are very much like that same concept. So when we're thinking about a tendon, imagine hair, in fact, and the way that your hair aligns together. If you were to brush your hair all in one direction, which is usually how we're taught to comb out a tangle, this is how you're going to get your tendons realigned. So tendons are like hairs. There's a lot of fibers together, and when they pull all as one, they're stronger, right? But as we use them throughout the day, we find that they will pull separately. One may pull loose, another one may pull loose, and then that's what's going to cause us a lot of pain. If we can realign them, like combing our hair, then we're going to have stronger tendons, and it alleviates a lot of the pain. Okay, let's get started. We've got our lubricant on, and now we're going to start going from one direction to the other. Again, I'm just using a medium type of pressure. I'm not trying to dig in and rip my skin off. I'm not trying to break the capillaries to see blood coming up under the bottom of my skin. If you are very delicate in your skin or very fair in your skin, you might go a little lighter and you will see some different colorations. But you shouldn't be to the point where, again, you're so bruised up, because then you're going into the technique of gua sha, which is different. You want to hold your tool at a slight angle. Try not to just be straight up and down, but at a slight angle. And what you're doing is literally combing out your tendons right now. Now, look at this person here and see the example. Right there in that part of their skin, lower and close to their wrist, is where their tendon is mostly out of alignment. As I'm doing this, you will feel a little bit of a bump or crunch. I like to call it the potato chip bag. When you get a crunch of potato chips in there, if you're slowly going across your skin, you'll start to find spots that become bumpy, like road bumps. And as you're going across them, you can lift and just isolate that section. Now notice here again, up in the middle of her arm, where she's starting to get red. So your tendons are only going to be out of alignment in certain areas. So if you look at that, she's got a red spot, then a not red spot, then a red spot, then a long red spot, right? So that section there is where her tendon is out of alignment the most. And then you can isolate just like this by only working out that one section. Again, stay going in that one direction. So I'm scraping down, but I'm picking it up and moving it back. You can do this for 5 minutes a day, rotating all around your entire joint. You do not want to go on top of skin and just bone. This is specifically targeted for tendons. So if you don't know where your tendons are, I'd suggest you look on Google or pull out a book of anatomy and start to see where your body has tendons. It should start to turn red, and I will not lie, this can become extremely painful, but the pain will go away almost instantly when you stop the therapy. Wherever you see it red is where it's the most out of alignment, and you can again target those areas to try and help relieve some of the pain. As you do this, skip a day, try again another day later. When you start to get very good at it and you find that your tendons are fully aligned, you are not going to need to do the therapy that often. I do my therapy probably once every 6 months, if I'm honest. Now we're going to go to a leg and take a look at what it looks like on a leg. Now, obviously, I don't have any lotion or lubricant on here, and I'm just going across my leg to show you, again, without the shine of the lens, what it's like. If you look carefully, you'll start to notice where my hand is going to get a little bit of resistance, and see that little bit of red spot starting to peek out there. Now this is on my calf, and on my calf I typically have a spot that I've always had where it always gets out of alignment, and it's because of the way that I walk and the way that I stand. After having several surgeries, my body doesn't stand the way it originally was designed to, and so I compensate. So one leg definitely gets more pain than the other. Again, just pick a direction for that day during that therapy session and just work in that direction. When you find those knots, you can sit there and just kind of work them out, and they'll actually move. You'll feel them kind of going down across the body, and then they'll disappear. If you first start out and it's totally numb and you don't feel anything, that's also normal, because a lot of people are so overworked that it's underneath so much damage that it's going to take a while before it starts to loosen up the skin above and the muscle above, the muscle below, in order to get the tendon to even recognize that you're working on it. So here we are again, looking at another person, and I'm coming across their upper shoulder from the back. So again, looking at her, I'm just combing it out. I'm using a light to medium pressure on her because this person has very sensitive skin. She's extremely, painfully non-tolerant, I should say. So I'm just trying to get enough therapy in her to get it started this day. But I definitely wanted to show you how different it's going to look from the beginning. Now, if you look at this again, I've been going at it for a few minutes on her. You notice how I'm scraping over the entire part of her body, but only one very specific spot, that long line across there, is very red and raised. That's the area where she's been saying she's got the most pain, where she could barely lift her arm. And this is also the line of tendons that are connected that she's damaged. So through here, I'm just working out those specific parts of those tendons now that I see the rest of it's not out of alignment. Again, you're only going to do it a few minutes at a time and then move on to another part of your body, build it up. This is what she looked like at the end of the therapy, and she said she had great relief in the next couple of days. It was a little sore the day after, did not break the capillary, so we did not have a lot of blood or bruising, but we did have some red raised skin. Thank you so much for watching this, and I do hope it helps.